Hello, and thank you for taking the time to prepare yourself for your upcoming surgery. This portion of the video will discuss transitioning home and home care services. My name is Chris Thomas, and I work for Hartford Healthcare at Home. Many of you will know of us as the Home VNA service for Hartford Healthcare. We are the premier provider of nursing, physical therapy, and occupational therapy services in the comfort of your home after orthopedic surgery. We are affiliated with your surgeon through the Hartford Healthcare Bone and Joint Institute, and we do look forward to caring for you inside of your home. So by the end of this video, what you will learn is what to expect when transitioning home with home care. You will also learn more about how to prepare yourself inside of your home, how Hartford Healthcare at Home will help you to prepare for that event, and an opportunity to actually pre-register those services so you know exactly who and when is coming to see you when you do discharge from the hospital. So now it's time for you to discharge home. You're in the hospital, you've been seen by nursing, physical therapy, and occupational therapy. They've been working directly with your care coordinator to determine whether or not it is safe for you to discharge home from the hospital. When they do determine it's safe for you to discharge and you've met your goals in the hospital, the care coordinator will meet you bedside inside of your room, and they'll discuss your preference for home care services. At that time, simply tell them Hartford Healthcare at Home is your preference, and they will work directly with the nurse inside the Bone and Joint Institute that works for Hartford Healthcare to ensure your transition home goes as smoothly as possible. So now, at the time of discharge, you're going to go home, you're going to fall asleep, and you're going to be concerned about when folks are coming to see you. The next day after getting home, the home care services will be coming to see you. So for example, and I use this example because it involves the weekend, if you were to discharge home on a Saturday, you'll receive a call on Sunday morning to be seen during the day on Sunday. Our promise to you and to your surgeon is that we will see you within 24 hours of discharge. At that first visit, you will have a nurse who will be admitting you to the home care services. And at that time, we ask that your support group be present as well, because what they will be doing is reviewing the entire plan of care that your surgeon personalized for you, and we want to make sure that if there are any questions that you have the opportunity to ask them. They will spend as much time with you as necessary. The visit does typically last about 2 hours, but it could be more or it could be less. In addition to the plan of care, they will be discussing with you safety recommendations concerning trip and fall hazards. So what that means is walking through your home and discussing things that may cause possible trips or possible falls. The last thing we want to see happen is have you trip or fall and end up back in the hospital. They'll also discuss with you nutrition. This is a very important part of your recovery process. The different foods that you eat can help to either speed up or slow down your recovery process, and we certainly want to see you recover as quickly as possible. In addition to that, they will discuss with you medication management. And what that means is making sure that you understand which medications to take, when to take them, and when it's actually appropriate to refill them, and who's responsible for doing that. It's important to us that you don't run out of your medications throughout this process. So when they are leaving, the nurse is going to contact your surgeon, and they're going to make sure that they know that you are home, and that you're safe and secure, and that you're being well cared for by Hartford Healthcare at Home. Now, in many instances, the physical therapist will not be present at that first visit. Your physical therapist will be calling to schedule their own appointment, so they do schedule their own time. When the physical therapist comes to your home, they will spend anywhere from 45 minutes to 60 minutes with you at each session. And you will have anywhere from 2 to 6 sessions per week, and that's completely dependent on your insurance and what they allow and what your surgeon has requested for you. Those sessions will continue for about 2 to 3 weeks in total, and when it's time to discharge, your surgeon will determine that it's safe to do so. Now, for many of you, you may also have an occupational therapist that comes to your home. The occupational therapist will also schedule their own time. So what they will be doing is coming out to your home to make sure that you understand your precautions and that you're capable of performing those surgical precautions after surgery to prevent you from having to go back to the hospital. They will work with you to make sure you understand how to bathe, how to use the restroom, how to make meals, how to do laundry, but more importantly, using your equipment inside of the home as safe as you possibly can. So now, at the end of the 2 to 3 weeks, your doctor will assess all the information that's been being directly provided to them throughout the process, and they'll determine whether or not it's appropriate for you to discharge from the home care services and start to care for yourself within your own home. At that time, they're going to request that you continue to do all of the therapy exercises that you learn from our therapist on a daily basis and to walk as frequently as you possibly can. So please, during your time with us, ask as many questions as you can and do work with the therapist to create a daily routine that will help you to achieve that goal. All right, so it is up to the surgeon to discharge you. And once you are discharged from the home care services, you'll be able to begin the rest of your life. So one of the opportunities that Hartford Healthcare at Home does embrace through the Prepare Center is pre-registering your home care services. By pre-registering your home care services, you'll have many benefits to you, and one of the most important being the peace of mind of knowing who's coming to see you and when. But the major benefit would be verifying your insurance beforehand to make sure that our home care service is an in-network provider for you and that you would not have additional fees to be able to perform those services inside of your home. The other benefit would be about 2 weeks before your surgery, we will be calling to confirm everything about the surgery, but more importantly, we'll be having a prepared discussion with you concerning your home environment and the durable medical equipment you have available, the support group that you have in your home. And if we find that there's a way that we can help you to prepare, we'll point you in that right direction. But the major benefit to that is we do have the privilege of sharing that information with your surgical team the week before your surgery. And that's important because now the therapy teams will be able to create a therapy plan for you inside of your hospital that's very much like your home environment so that you know inside that it's safe for you to discharge home as well. So I do appreciate your time. And should you like to pre-register those services, I would appreciate the opportunity to work with you. There are many ways to do that. You can call our intake team, and we do provide the phone number for you to do so, and that's 1-800-HOME-CARE. You can actually complete the form that's being provided for you as well, and you can either fax it, email it, or you can actually provide it to me in person as well. And the other opportunity is to be able to ask your surgeon to pre-register for you. So, in addition, should you have any additional questions, I do provide you my cell phone number, and this is if you have any questions, your support group has any questions before or after surgery for home care services, and I do provide you with my email address. So please, I do urge you to use me as a resource. My door is open to you. And I thank you again, and I look forward to caring for you after surgery.